For my thesis defense, I did about genetic mutation analysis in colorectal cancer, which is the identification of critical genetic drivers and their role in tumor development. So for me in my research, as I already said before, my research topic is the genetic analysis in colorectal cancer by identifying the genetic drivers and their role in tumor development. And I explored this issue because my long-term goal is to become a physician and focus on illness prevention and also focus on population well-being. And during my time of volunteering at a local hospital, I became aware of the difficulties that people with cancer endure daily, which prompted me to pursue this idea. And I'm a junior at Hamilton High School in Chandler, Arizona. So for the introduction, my objectives is that the focus of conducting this study is to identify the gene drivers that cause colorectal cancer and the efficacy of it in tumor growth termination and eradication. So some of the research questions I had were, what are the most common gene mutations associated with colorectal cancer, and how do they contribute to tumor initiation and progression? And my second question was, what is the importance of understanding the genes that cause colorectal cancer? Moving on to the importance, identifying genes like ITIH2, TIMP1, and CXCL1 is crucial for understanding colorectal cancer. And research by Wang et al. Shows ITIH2 as a core gene influencing tumor progression, and while TIMP and CXCL are linked with metastasis and poor outcomes. So some of the background information includes that colorectal cancer is the third most common type of cancer in the world and in the US as well. And it begins in the colon or the rectum and parts of the large intestine. And it's one of the most common cancers in the worldwide. And it can be influenced by external factors such as age, diet, lifestyle, and genetics. So moving on to what are the risks associated with this type of cancer? This includes family history of CRC, inflammatory bowel disease, and inherited genetic conditions like Lynch syndrome. And these type of treatments typically involve surgery, chemotherapy, radiation, and targeted therapies, depending on the stage and genetic characteristics of the cancer. So moving into literature review. So colorectal cancer is driven by a complex interplay of genetic and environmental factors. Over the years, extensive research has focused on identifying specific gene mutations that contribute to the onset and progression of CRC. Recent research has expanded beyond these well-characterized mutations to identify novel genetic drivers. For example, Liu et al. Identified mutations in genes such as FGA and ITIH2 in CRC patients, suggesting their potential role in tumor development and metastasis. So moving on to methodology. I initiated the study by reviewing current research on current treatment therapies for CRC, focusing on the potential for utilizing these genes by identifying these genes that initialize CRC for future prospects of full recovery of the colorectal region. Next, I analyzed multiple information from multiple clinical trials, such as scientific journals that include Google Scholar, Medline, and PubMed, evaluating the recognition of genes involving CRC. Then I saw what are the most major genetic drivers involved in colorectal cancer. So moving on to results, I realized that ITIH2 and some of the hub genes were involved in CRC progression. Zhang et al. Found that ITIH2 is significantly overexpressed in CRC tissues and correlates with poor survival, making it a promising genetic biomarker for early diagnosis. Novel genetic mutations, including Liu et al., discovered mutations in genes like SERPIN-C1, FGA, and TIMP1, which were associated with tumor metastasis and poor patient outcomes. These findings suggest that these genes could serve as novel therapeutic targets for inhibiting CRC progression. Lastly, I found CXCL1 and TIMP1, which included research by Wang et al., highlighted the importance of CXCL1 and TIMP1 in promoting tumor invasion and metastasis. Overexpression of these genes correlates with advanced disease stages and poorer survival rates, making them potential targets for new treatment strategies. So moving on to conclusion, this study underscores the critical role of gene mutations such as ITIH2, CXCL1, and TIMP1 in colorectal cancer progression. And these are associated with tumor growth, metastasis, and resistance to treatment. So some of the future research includes like using these genes and promoting gene therapy that could be targeted for eradicating most of the colorectal cancers. And some long-term studies include evaluating the clinical efficacy of these therapies that target these genes, particularly in treatment-resistant cases of CRC. So talking about my research experiences, Dr. Prahalad was a really great mentor, and his original lectures in the beginning of this program was really successful in helping me identify my research topic and identify more sources. And also my creative writing teacher, Professor Virgil, helped me create an excellent paper and also corrected my mistakes that I made along the way. And I also thank Coach Joe for creating this platform and which honed my skills and allowed me to get great research papers, which I wouldn't have done without this program. Thank you. And if you have any questions, please put in the chat.
A great presentation. Thank you for the kind words. You want to turn off your presentation and Dr. Prahlad will ask you a question?
Yeah.
Hey, good job, Ashwin. Great
Thank you.
presentation. Yeah. So my question is, so has you looked at some clinical trials also, right? So has anything moved forward? Is any of the genes being targeted, and is it being combined with any other therapy? What did you find?
No, it's not really prevalent recently. So that's what I'm saying. More identification is really good, and more gene therapy should be followed in the long-term prospect, which could be used in the future.
Mm-hmm. Yeah, excellent. Yeah, great presentation. Congratulations.
Awesome job. Okay.